Namaste, Dr. Divya here, and welcoming you all in the session of yoga therapy. Today we are going to learn about the respiratory disorders and in that also the sinusitis and what is the role of yogic diet and how to prevent it by the process of yoga therapy. So let's begin the session. Sinusitis is an inflammation swelling of the tissue, and also sinuses are the structure inside your face that are normally filled with air. Bacterial infections, viral infections, and allergies can irritate them, causing them to get blocked and filled with fluid. This can cause pressure and pain in your face, nasal congestion, and also a stuffy nose as well, and other symptoms. Sinusitis is also sometimes called as rhinosinusitis. So, what are sinuses? That sinuses are four paired cavities, spaces in your head. Narrow passages connects them. Sinuses make mucus that drains out of the passages in your nose, and also this drainage helps to keep your nose clean and also free from bacteria, allergens, and other germs, which is called as pathogens. And what are the types of sinusitis? There are different types of sinusitis. So, types of sinusitis based on how long it's been going on. So, acute, subacute, chronic, or recurrent. And what's causing it? The bacteria, virus, or fungus. So, acute, subacute, chronic, and recurrent sinusitis are acute sinusitis called as the symptoms in which the nasal congestion, drainage, facial pain, pressure, and decreased sense of smell last less than 4 weeks. It is usually caused by viruses like common cold. Second one is the subacute sinusitis, which symptoms last 4 to 12 weeks. The third is the chronic sinusitis. In symptoms at least 12 weeks, bacteria are usually the cause in it. And recurrent acute sinusitis symptoms come back 4 or more times in 1 year and last less than 2 weeks each time. Bacteria and viral sinusitis, like the viruses, like the ones that cause the common cold, cause most causes of sinusitis. Bacteria can cause sinusitis or they can infect you after a case of viral sinusitis. If you have a runny nose, stuffy nose, and the facial pain, then don't go away after the 10 days. You might have the bacterial sinusitis. The symptoms may seem to improve, but they return and are worsened than the initial symptoms. Antibiotics and decongestants usually work well on the bacterial sinusitis. The fungal sinusitis. Sinus infections caused by fungus are usually more serious than the other forms of sinusitis. They are more likely to happen if you have a weakened immune system. It will definitely affect you. What are the signs and the symptoms of sinusitis? We'll learn also in this session. Common symptoms of sinus infections include the postnasal drip. You can say the mucus is dripping down your throat. Okay. Second one, you can see the runny nose in most of the people with thick yellow and the green mucus. The third is the stuffy nose. The fourth, the facial pressure, particularly around your nose, eyes, and the forehead. This might get worse when you move your head around or bend over as well. Pressure or pain in your teeth, also it's there. The ear pressure, ear pain, you can feel it. The fever, bad breath, which is called as the halitosis, or a bad taste in your mouth. Cough, headache, tiredness, because you cannot even sleep because of the sinusitis. The tiredness you will feel on your face. What causes sinus infections? Viruses, bacteria, fungi, and allergens can cause sinusitis. Specific triggers for sinusitis include the common cold, the flu influenza, and also the streptococcus pneumoniae bacteria. And also there are other bacterias as well, which is there in the sinusitis. So what are the risk factors for sinusitis? There are different types of risk factors for the different people. And also some people are more likely to get sinusitis than others. Risk factors include the nasal allergies, you can say. Second is the asthma. Third is the nasal polyps, the growth you can find. One of my friend has it. And also the deviated spectrum. Your spectrum is a line of the tissue that divides the nose. A deviation spectrum that isn't straight, narrowing the passage. Okay, it narrows the passage on the one side of your nose. And this can cause a blockage. Okay, and a weakened immune system as well. This can from the illness like the HIV or the cancer or from certain medications. Smoking. Specific tests that you should that your healthcare provider might to order to diagnose the sinus infections, which includes the nasal endoscopy and also the nasal swabs like in COVID-19 you have seen, right? The soft tipped stick to get a fluid sample from your nose, and they will test a viruses or the germs that might be causing your symptoms. Imagining in some cases your provider might order a computed tomography, which is the CT scan, to better to understand what's happening inside your sinuses. Allergy testings. If you have a chronic sinusitis, your provider may test you for the allergies that could be triggering it. There are different tests for the allergens as well. Because in sinus, what happens if a small allergens will, destruct your condition of the body. So what are the preventions you should take? Can sinusitis be prevented? So I must say it is depending on the cause, that there are few ways to reduce your risk of getting sinus infections, including you can do the rinsing your nose or for the saline water as directed by your doctor first. Taking steps or to prevent the allergens. This includes the medications, allergy shots, avoiding your triggering allergy like dust, pollen or smoke. Using steroids, nasal sprays if your provider recommends you, even the perfumes as well. Establishing good hand washing techniques, other habits like reduce your getting sick with the infections disease. Avoiding smoke, that there are ways to help quit smoking if you do. And also I must recommend for the yoga part the Kunjal Kriya, Jal Neti and the Sutra Neti is very good. Like it is a best technique for the sinusitis. In the sinusitis, if you have the polyps in your nose, so sometimes the Sutra Neti will hurt. So you can use, there are two different types of nitis. One is the rubber and one is a very waxed one. Waxed one is more preferable rather than the rubber one. So I must recommend in the starting of the phase, you should go for the rubber one. But yes, you should go first under the guidance of yoga therapist first, not by yourself, even on the offline mode, not even the online mode, I must recommend. So these are the techniques you should prefer for the sinusitis, and also there are the chants you can go for it and the pranayam. After the kriyas you can go for the shatkarm like the kapalbhati, and after that there are some asanas like sarvangasana and simhasan is one of the good asanas, so you can do the asana. And after that pranayam like nadi shodhan, ujjayi and Bhastrika. I must recommend these three, especially for the sinusitis. So go for the first Shatkarm practice like Sutra Neti, Jal Neti, Kunjal Kriya. And after that, if you will go directly towards Kapalbhati, it's also good. And afterwards, if you will prefer only pranayam, then go for it. So this is the all aspect of the yoga therapy aspect, and you have to don't eat about too much of spicy food and a lot of these type of foods. Eat fresh vegetables and fruits so that you can easily boost your immunity, and you have the ability to fight with the allergens or the with the allergens to which is present in the outside of the environment. So this is all about the concept of sinusitis and role of yoga therapy and the yogic diet in it. Thank you so much for attending this session.